Does CPAP work for central sleep apnea? If you or someone you know has been diagnosed with central sleep apnea, you might be wondering if CPAP, a common treatment for sleep apnea, can help. Let's break down the details to understand how CPAP works and whether it's effective for central sleep apnea. Central sleep apnea, or CSA, is different from obstructive sleep apnea. While obstructive sleep apnea is caused by a physical blockage in the airways, CSA is often linked to neurological issues, where the brain doesn't send the right signals to breathe during sleep. CPAP, or continuous positive airway pressure, is a device that delivers a steady stream of air pressure to keep the airways open. It's highly effective for treating obstructive sleep apnea, but its effectiveness for central sleep apnea is more complex. For some people with central sleep apnea, CPAP might not be the best solution. In fact, studies have shown that CPAP can sometimes make central sleep apnea worse, a phenomenon known as treatment-emergent central sleep apnea. This happens in about 10% of patients who start CPAP for obstructive sleep apnea but then develop central apneas. However, in some cases, CPAP can still be beneficial, especially if the central sleep apnea is mild or if there are also obstructive events present. For instance, if you have a mix of both obstructive and central apneas, CPAP might help reduce the obstructive events, and in some cases it can also reduce the central events. But for many patients with central sleep apnea, especially those with more severe or complex cases, other treatments are often more effective. Adaptive servo-ventilation, or ASV, is a type of therapy that adjusts the air pressure automatically to match the patient's breathing needs. ASV has been shown to be more effective for treating central sleep apnea, especially in patients who don't respond well to CPAP. In addition to these mechanical treatments, lifestyle changes can also help manage central sleep apnea. This includes weight loss, avoiding tobacco and alcohol, changing sleep positions, and using nasal sprays or allergy medicines. In some cases, treating underlying conditions such as Parkinson's disease, congestive heart failure, or hypothyroid disease can also help resolve the sleep apnea. So to answer the question, CPAP can work for some cases of central sleep apnea, especially if the condition is mild or mixed with obstructive apneas. However, for many patients, especially those with more complex or severe central sleep apnea, other treatments like ASV or addressing underlying health conditions may be more effective. Always consult with your healthcare provider to determine the best treatment plan for your specific situation.